I'm going to thank the Business Record for convening this discussion today. It's been very helpful, a lot of great speakers. I'm the president and CEO of the Iowa Healthcare Collaborative. I'm trained as a family doc, but since 2005, I've been working with all of the physicians and all of the hospitals in the state to advance sustainable transformation of our healthcare system. How do we create sustainability in a rural state where we have moved from a transactional-based system to this value-based system going forward? That's the world we've been living in before the pandemic pineapple hit. I want to allude to a couple of speakers who spoke before me before I introduce my comments, but Lieutenant Governor Greg introducing the broadband connectivity piece is huge. And then again, I just loved what Debbie Durham said with regard to in the turn of a dime, we've gone from a transactional based to a relationship based world. That is going to leave a mark on healthcare. And what I want to talk about today is the rise of telemedicine. So I believe that the world's going to be a different shape. The current social distancing is going to leave a mark as we go forward. And this telemedicine, I believe, is going to rise as a viable and necessary way to deliver healthcare in the future. We're experimenting with it right now, but the fact is consumers are going to love some pieces of it, and I think it's going to become the way we do business. It's interesting historically to think about this. Over the last 20 years, we've had telehealth and we've had telemonitoring, and they've only had limited success. Telehealth has been by telephone. Can you help me, doctor, stay compliant with the diagnosed strategy already? And telemonitoring is the way that we would gather, gather data from patients to kind of make sure that they're being compliant with their programs. Because of that, there have been limits to the applications, and the insurance companies haven't been real hot on paying for this. So as a result, all of this telemedicine stuff has been lingering on the sidelines for probably the last 15 or 20 years. The pandemic pineapple basically has forced both providers and patients and payers to explore different methodologies now. How are we going to deliver care? So what we're seeing right now is tremendous innovation, and frankly, we're learning a lot. We're learning a lot about what you can do and what you can't do with video conferencing for the delivery of medical care. An example is I was talking to a patient, or actually a friend of mine, a 38-year-old female, about a recent video visit she had. Now, she was a healthcare provider. She was a surgical care nurse, and she has a medical problem, had to see her physician. And normally, and she told me, normally what happens is she would have to take the afternoon off. She'd have to drive across town, sit in a waiting room with a bunch of sick people, get into the doctor's office, wait for the doctor whose schedule now is pushed back because of other emergencies, and eventually see the physician, drive back home, exhausted, and frankly, a little irritated. In this particular situation, she had a virtual visit. It took 17 minutes, and she sat in her kitchen. And she was delighted. She said she saved time, it was clear, it was efficient, and it was effective use of her time. So I want to just make the point that as we move into telemedicine, the benefits of this are real. The patients engage better. They become activated partners with their care. It takes less time for both, it can take less time for both than the traditional visit for both the provider and for the patient. And that doesn't even mean driving across town. And in particular, and particularly important to a state like Iowa, is we can improve the access to medical care across our rural state. Rural environments may not have access to certain specialties or ways to support more complex services. So this is a real opportunity. I think, though we've talked about telemedicine and telehealth over years, that we've been kind of dabbling with it, I think healthcare is better prepared to support the model today than we've ever been. The conditions are right. We have electronic health records and patient portals that people are more used to using, and we can support this. Consumers are more broadly using smartphones and the internet now. And interestingly, some people worry that this may be generational. We may have certain, like the millennials will be able to get this, but old guys like me, the boomers and the silent generation, won't be able to turn the corner. And the facts are that the boomers and the silent generation are one of the fastest adopters of some of this new technology, and they're rapidly acquiring the skills. The pandemic, again, back to Deidre's point about the pandemic pineapple here, it's turbocharging the innovation that we're seeing with telemedicine right now. doctors and hospitals are having to do this just to be able to see patients and stay in business right now. And I was on the phone yesterday just checking around, but we got family doctors and pediatricians across the state using virtual, virtual visits to try to, in their daily schedule currently. I saw a story where a health system is experimenting with virtual waiting rooms. So rather than having people sit in the waiting room now, what they do is they sit in their car, and an app on their phone will tell them when to come in because their room is ready. And obviously there's opportunities for access to specialists and specialties. We have we have virtual ICUs that we're supporting in rural communities. We have hospitalists that don't even have to be in the same town to provide some of the care. And I heard yesterday about a psychiatrist. Everybody knows what the challenges are with mental health in our state. A psychiatrist who is 100% virtual services. So just to kind of begin to bring this down, we're experimenting with this. Providers are experimenting with it, and insurers are experimenting with it. And because of COVID, what's happened is some of the privacy and security regulations have been relaxed, and some of the payment for this have been strengthened so that it's actually working. But I think it's important for us to be thinking, if this is an innovation that we want to stick going forward to improve the quality, the safety, and the cost of healthcare, we're going to have to kind of leave a mark with regard to the privacy and security. There's more work to be done there, and we've got to make sure that the payers are going to continue to support this. So kind of wrapping up, our experience with social distancing has forced us to do this, and obviously this has put our healthcare system in crisis. What's going on right now is patients are going to get worse if they can't see providers, and the health gets worse, and frankly what happens is the cost goes up. For the provider community, if they can't see patients, they can't stay in business. And if they can't stay in business, access to healthcare gets worse, and the health of the community gets worse. So basically, this is an innovation, I think, that's going to be a real important improvement for us going forward. So kind of in summary, today, many providers and health systems are piloting virtual visits. I would encourage you to use them wherever you possibly can. Give it a try. There's going to be some glitches as we get going, but the more we learn, the better we're going to get with this. We're learning a lot about what works and what doesn't work in the system, and there's a lot of opportunity to improve the current system using tools like this. In closing, I believe that the improvement in patient experience and convenience will create high demand for these services. I think in the future, consumers, this will never be the same. Consumers will expect services like this. But to make this pilot a reality, work needs to be done on privacy and security, and we have got to support payment for these services. This shouldn't be done like we've done in the past, where it was some kind of a sexy add-on service. This needs to become the way we do business. So in summary, I believe that telemedicine is good for Iowa. And I think even after this challenging time with COVID, I think it's going to be here to stay as a way that we do business. Thanks a lot.